So cataract comes from the Latin cataracta, and that was how they described the froth that comes up from the bottom of a waterfall, that whitish froth, because cataracts cause mistiness of vision. They can cause blurred vision, mistiness, glare, and all sorts of problems like that. If you imagine there's a lens inside the eye, if you imagine a magnifying glass, it has a glass lens, and that is exactly what your lens is like. It's much smaller, about smarty size, but it should be completely clear. As we get less young, the lens becomes less clear and it can become cloudy. If it hits a certain level of cloudiness and it causes symptoms, then we call it a proper cataract, and then sometimes we need to fix it for you. The lens is formed of crystalline molecules, and the crystallines are usually completely clear. They're a protein, but then as time goes by, just like everything else, they degrade and they become cloudy. So they go milkyish first of all, then they can go yellow, and then they go brown, and that can markedly reduce the vision. Aging is the major risk factor for it. There aren't any multivitamins or anything like that can stop it. Sometimes there are conditions that accelerate it. Diabetes, for example, if you use steroids for asthma in childhood or recently, then that can accelerate it. But the vast majority of people is just the aging process. Young people can get it as well. You can get congenital cataracts. Or if your parents had cataracts early, then you're more likely to get cataracts early. But most of you will be in the sort of 60s, 70s when you start developing cataract, and that's when we jump in and fix it for you. Unfortunately, there is no other treatment for cataract apart from cataract surgery, but that does not mean that you always need to have a cataract procedure done. Fundamentally, if it isn't broken, we shouldn't try and fix it. If your cataract is causing you no trouble at all, then it's entirely reasonable to leave it alone until it does start causing you trouble. If it's causing you symptoms, glare, blurred vision, mistiness, or other problems, then we can fix it for you, and the surgery is actually very easy and straightforward. It is an operation though, there is no magic pill that you can take, and there are no pills or potions that can slow down the rate of the cataract formation. It's just one of those things. It can eventually, cataracts get worse, your vision gets more and more blurry, but it all depends on whether it's affecting your quality of life and whether that effect is significant to you. If it stops you driving, then that's a big threshold and something that we tend to intervene to get sorted out before you reach that threshold. We rarely allow people to get to the stage whereby it significantly affects their vision, as in blinds them, but sometimes we do still see people, usually people who are scared about cataract surgery, leaving one eye get worse and worse and worse until they can't see out of it. So it does get worse with the passage of time, but it is eminently treatable, and usually we catch it well before it causes major problems. Once the cataract surgery is done, the lens is gone, so you can never get another cataract. It's gone and that's it. We replace it with a thin synthetic lens. If you imagine the lens is like a Smartie inside the eye, your native lens is like a Smartie inside the eye, it's got a clear cellophane bag around it. We make a circular access to that bag that holds the lens in place and then eat away the cataract. That bag stays for our new lens. We inject the new lens into that bag, it unfolds and holds itself in place. But that clear bag becomes cloudy in about a quarter to a third of people. It's called the capsule, and you develop what we call posterior capsular opacification. It's actually due to cells sitting within that bag that start growing again and try and form a new lens, which it can't do obviously. And then it grows across and you get a frosted glass appearance or a net curtain appearance developing behind the lens. That's easily zapped away with some laser treatment. Typically occurs 2 to 3 years after cataract surgery, but it can develop sooner. Once that laser's done, then you can never get a problem again. It's all sorted out. So cataracts can never come back again, but posterior capsular opacification can occur. The cataract diagnosis is usually clinical. The patient's vision goes down, you get blur, glare, things aren't quite right. You see your optician, they have a look and they can see the cataract. They refer you on to me. I physically look at you on something called a slit lamp. I shine the light across your lens. It should be completely clear, but when you have a cataract, it goes cloudy. And the cloudiness can be in different places in the lens, but first and foremost, it blocks the light off. So I can physically see the cloudiness there. It goes yellow, it goes white, and eventually, if we leave the cataract alone or let it get too advanced, it goes brown. So I physically see the cataract. And then we've got to assess the eye and see whether there's anything else going on as well. So we look at the back of the eye and see whether that's affecting the vision as well. So it's a full examination. We don't just focus on the cataract, but the diagnosis is fully clinical. We can see the cataract. First and foremost, cataract surgery is very, very safe. It's one of the safest things you can have done, but the implications if it does go wrong are significant because it's your vision we're talking about. Thankfully, personally, my complications are very, very low. And in fact, right across the NHS and the whole private sector as well, the complications are very, very few and far between. But if they do occur, they can be significant. Your prognosis really depends on how bad the cataract is and how bad the back of the eye is. We assess the front and back of the eye. If you've got a decent going cataract and a healthy back of the eye, then the prognosis is fantastic for vision. If there's damage at the back of the eye, for example, things like age-related macular degeneration, then your prognosis may not be so great. I liken it to a camera. If the film at the back of the camera isn't working properly, then regardless of how clever a lens you put at the front of the camera, a clever clear lens is not going to make any difference to you. So if you've got significant problems at the back of the eye, then taking the cataract out may not give us what we want. That's the exception to the rule. The vast majority of patients get excellent visual outcome. Of course there are problems, and 1 in 100 people may run into problems that often we can fix, but if it's catastrophic such as infection, then it can leave you with blurred vision. It's important you know that. But first and foremost, the prognosis is usually good in the vast majority of people, so you shouldn't worry about it.